In today's On Your Side Health, the flu season's underway and one death is already being blamed on the flu in Cuyahoga County. Now we've learned a medication to treat the virus, Tamiflu, is in short supply. However, the shortage only involves the liquid form of Tamiflu. Doctors typically give the liquid form to children or people who have trouble swallowing. The manufacturer expects the shortage to last only through the end of this month. Dr. Thomas Tallman, the Cleveland Clinic's flu expert, is closely watching the flu season as it develops in Northeast Ohio. Thanks so much for being here today. Are you seeing cases start to jump up here in Northeast Ohio?
We've had some increases in our hospital. Nothing that's at a real high rate yet, but we are starting to see it that we can confirm.
The reports are that the dominant strain circulating is H1N1, which was behind the pandemic back in 2009. So who does this primarily affect?
Well, we're still worried about the extreme age groups, so to speak, like the really young, the older patients. But when you think about it also, older patients like me, we've been around a while. We've actually built up some resistance and immunity that some of the young healthy patients that are ending up with the flu saying, hey, I'm young and healthy, why did I get it? And you actually have less immunity than those of us that have probably had the flu shots and have been around now.
Very interesting. There are other strains of seasonal flu circulating as well, though.
Yes.
And are they covered in the vaccine?
So to remind everybody, yeah, that vaccine you can get either the trivalent or quadrivalent, which means you can either get protection against 3 of the viruses or 4, but overall it's still the most likely ones that would make you sick, but not all of them.
Yeah, it's not too late to get the flu vaccine.
No.
Do you see a lot of resistance to getting vaccines?
Well, there's a variety of reasons for the resistance, and I think there is still some resistance to it. But these kind of things, pushing this out now, getting right in the heart of flu season, is a good time. If you're on the middle and not decided, this is a good time to decide. Do it.
It's been a pretty rough flu season in some parts of the country, notably, I guess, the Southwest. And so, would you expect to see it hit pretty hard here ultimately?
It's hard to say that we're going to see that kind of predominance that we've seen like in other states like Texas, where you see more ICU admissions and even some deaths related to the flu. And it's hard to predict that. I would say we're still going to maybe just head into a regular flu season, but we're getting into the heart of it now. We'll see.
Yeah. So we talk a lot about how to protect yourself other than the vaccine. And I know, for example, Akron Children's is really cracking down on their what they're allowing visitors, how they're allowing visitors to come in. They can't come in if they've got a sniffle or anything like that.
It's a good way to protect your patients because they're already vulnerable from being in the hospital anyway. And it's so hard for someone to differentiate whether they just have a bad cold or the flu. So if it's any influenza-like illness, it's best to just avoid contact.
And how do you know if you need to get to the emergency room?
Well, I think you still want to go by symptoms. If you're running a fever, that's a little more likely to be flu as opposed to a cold. If you're having respiratory symptoms that are giving you difficulty breathing, that's a concern. I think that's always going to be it, and I think that's the kind of thing that we want to watch for, especially respiratory symptoms.
And maybe to help prevent spread of flu, you know, you keep that antibacterial gel handy, and maybe instead of shaking hands, fist bumps this year.
Fist bumps,
for
elbows,
season,
yeah, just to, that's it.
All right.
I like
All right.
that.
Dr. Thomas Tallman from the Cleveland Clinic, thank you so much for being here with us today.